Well, joining us now is In Focus health correspondent Linord Moudou. What do you have for us today, Linord?
Hello, Vincent. Today it's about rare diseases. It is Rare Disease Day, and it's an annual event celebrated on the last day of February to bring widespread recognition of rare diseases as a global health challenge. In the United States, a disease is considered rare when it affects fewer than 200,000 people. Rare Disease Day is coordinated by the European Organization for Rare Diseases, EuroDis, and the National Organization for Rare Disorders, NORD, in the US. The 2013 slogan is Rare Disorders Without Borders, to convey the global solidarity of the rare disease community and the need for collaboration and mutual support in the field of rare diseases. Now joining us via phone from Paris to tell us more on rare diseases is Dr. Alain Verloes, Professor of Medical Genetics of Paris 7, Denis Diderot University. Professor Verloes, welcome to the program.
Thank you.
First of all, tell us more about the epidemiology of rare diseases. How prevalent are they and in a region like Sub-Saharan Africa, for example?
Yeah. Well, in fact, it's a cheating name to say that are rare disease because, in fact, each disease which is called rare is defined as affecting less than 1 person on 2,000. But if you count all the rare diseases that could exist, and there are more than 3,000 different, in fact, it affects more than 1 or 2% of the population. So rare diseases are rare one by one, they are quite common altogether. The problem is, in fact, that we have no good information about the frequency of rare diseases in Africa. In fact, it's not even well known in Europe or USA because you have no registry that would record any case of a rare disease. And for Africa, it's even less known. So, in fact, we don't know absolutely nothing about rare disease in Africa.
Now, as a specialist, what do you see as the most challenging aspect of combating these diseases?
Well, to combat this disease, you have two things. Many problems in those rare diseases are not rare. You can treat them by surgery, you can treat them by common drugs, but some problems for some disorders needs to recognize exactly the disorder. You have to have an access to sophisticated tests, for instance, because some drugs will only be useful and efficient for one specific disorder. And one of the difficulties I've seen in Africa is the complete lack of access to those high-level technologies that allow you to diagnose some of those rare disorders. Most of them are genetics. 80% of them are genetics. So you have basically genetic tests that you could do to recognize them, but there's almost no genetics in all Africa.
And quickly, in 10 seconds, are any of them curable?
Yes, many of them are curable. Well, you cannot correct the genetic disorder, but you can compensate the problems. If you have 6 fingers, you can just remove 1 finger and you have corrected your disorder. This is a big simple example, but some disorders are completely curable, and it's not because you have a genetic disorder that you have a severe disorder.
Okay, Professor Alain Verloes, thank you so much for joining us today.